It's new tonight at 11. The agreement that started the Ballad Health merger got a checkup from the Federal Trade Commission.
It's part of an ongoing effort by the FTC to address the impacts of the COPAs that replace competition with state oversight on healthcare quality, also access and innovation.
Jackie DeFusco was in Washington, D.C. for the all-day workshop where 90 minutes were dedicated exclusively to the discussion of Ballad Health.
Josh, Sarah, Federal Trade Commission officials think it's possible that other states will start using COPA-like agreements as a solution to healthcare challenges. That's why the FTC brought in a panel on Ballad Health to discuss early experiences. State regulators set high expectations for Ballad Health's COPA at a Federal Trade Commission workshop.
We expect Ballad to be the leader.
The panelists representing Ballad touting their commitment to invest savings and improve population health.
There has been not just we're going to take $300 million and we're going to attack the health status of our community. We also said we're going to create an index to prove we did it.
Regulators admit the results of the COPA are still unclear.
In terms of the performance, what I can tell you right now is it's too soon to tell. We've only been in effect for 16 months.
Others on the panel questioning whether state oversight of Ballad is adequate.
The regulatory requirements and governance and other areas that were in here were not sufficient to make this into something that we could guarantee that the benefits would outweigh the risks.
The president of Holston Medical Group also criticizing Ballad's choice to consolidate trauma and NICU services in Johnson City.
It will impact the geographic distribution of services. Not necessarily based on where patients need them, but based on what's economically efficient for the systems. Maybe we don't need 2 trauma centers, but maybe we need the trauma center in Kingsport.
One insurance provider raising concerns about patient choice and higher costs as a result of the merger.
We're also worried about things like drug, lab, some imaging services, and having those services flow back into the hospital setting at much higher rates.
An academic saying it's imperative that the FTC conduct an in-depth study of Ballad Health's COPA.
If the thought here is that we're going to do a pseudo investigation by calling it a study when we have complied with everything that's constitutional and legal, I don't think that would be right.
The Federal Trade Commission will be collecting public comment on COPAs on their website until July 31st. In Washington, Jackie DeFusco, News Channel 11 in your corner.
Jackie, thank you. Join us next week for Jackie's exclusive reporting from the FTC, featuring interviews with local advocates, health policy experts, and government officials.